Hello, everyone. Thank you so very much for joining us. This time, it's not a teaser. We are going to go ahead and get the webinar started. During the webinar, your conference line will be muted, and if you have a question for the presenter, which surprise, it's me, please type that into the chat box, and I'll be checking that periodically. I'll also attempt at the end of the webinar to unmute conference lines, which can have mixed results. So you will have some opportunities possibly at the end of this webinar to ask questions over the phone, but if you do have questions, the best way to ensure that they're seen is to type them into the chat box. So thank you for joining us. My name is Bill Funder. I'm the Incentives Program Manager at the Office of Rural Health. I work on the Workforce Services team, which is led by Deputy Director Robert Dumeg, and on that team is Stacy Reed, our Recruitment and Retention Manager, and Annalie Veneri, our Workforce Services Coordinator. Today we're going to be going over, we're going to be touching on some key requirements and participation for incentive programs. We're going to be talking about HPSAs just a little bit. We're going to briefly touch on the provider application, but really we're going to be focusing on the site application. The Office of Rural Health is Oregon's Office of Rural Health. We are housed at OHSU. My email address has a @ohsu.edu address, but we are not an OHSU department. We are Oregon's Office of Rural Health. All 50 states have an Office of Rural Health, and we are Oregon's. We do all kinds of really cool things out of this office, one of them being provide recruitment and retention support for Oregon's underserved communities, and part of that recruitment and retention efforts are administering state incentive programs. Moving right along into HPSAs. We're going to be hearing about HPSAs a fair amount during this presentation, and I wanted to make sure that everyone is aware of what a HPSA is. HPSA is an acronym for Health Professional Shortage Area, and it's a way of analyzing access to health care or lack thereof for different groups of people. There's all kinds of reasons why HPSAs are important, but the main one that we're going to be talking about today is they are an access point for sites and providers to access both state and federal incentive programs. There are three different types of HPSAs, that being dental health, mental health, and primary care. And those HPSAs can be assigned to geographic areas like a county. Perhaps we'll have a dental, a mental, primary, perhaps all three. It can be assigned to, and that could be, a geographic area having a limited number of providers to citizens ratio. It could be assigned to populations of folks, like there are pockets of Multnomah County that will have like a mental health HPSA because of some of the populations that live within that county. And then finally, there can be facility HPSAs. Most of Multnomah County does not have a primary care HPSA assigned to the county, but there are facilities within the county that have a HPSA because of the type of populations that they see. The greater the HPSA score, the greater the perceived need. HPSAs are on a scale of 0 to 25 for primary care and mental health, and 0 to 26 for dental health. HPSAs are not administered at all through my office. However, we do use them in our programs. They are assigned by HRSA, the Health Resource and Service Administration, and the primary care office over at the Oregon Health Authority collects that data, works with HRSA, and HPSA scores are assigned. Recently, being in 2018, the primary care office worked with HRSA, and HPSA scores, geographic HPSA scores, non-facility HPSA scores were reviewed and updated. So if you're aware that you had a HPSA but haven't looked into it recently, it could be that your HPSA scores have stayed the same, gone up, possibly gone down, and I believe that HRSA is going to be reviewing all facility HPSAs this year. Once reviewed, those HPSA scores remain relatively stable. for several years with the primary care office here and there working with practice sites on getting HPSA score updates if it's believed that it's needed. But if you are interested in learning more about HPSA scores, we have a contact over at the Oregon Health Authority that you can get a hold of. Moving into our programs, the very first program that we're just going to be touching on, again, we could do a whole webinar just on this particular program, but we're just going to briefly give you an overview of this program. It is called the Healthcare Provider Incentive Loan Repayment Program. We call it Loan Repayment for short. It is housed at the Oregon Health Authority and administered by my office, the Office of Rural Health. Here's a list of eligible providers for that particular program. I'm not going to read it off. All of this information is on our website, which I'll be touching on briefly here in some to-come slides. But what I do want to point out is what's interesting about this provider list that perhaps you're not aware of is this program allows for naturopath doctors, NDs, which is not something that is kind of unique for this program. I don't know of any other programs that accept NDs. Could be out there, but I'm not aware of them. So it's an expanded practice dental hygienist. Again, that does have to be expanded practice, not just a hygienist, but expanded practice. But those are two interesting components from this list. The other, starting earlier this year, at the beginning of 2019, this program allows for mental health providers who are working on their hours for licensure. And they have to be an approved site, but if you have providers, mental health providers who are working on licensure hours at your site, they may be eligible for this program. Qualifying sites for this particular program, a site has to be located in or have a HPSA score, be serving Medicaid and Medicare patients, and no less the same proportion of which that lives in the county in which the clinic is located. And that means if your site is located, say, in Multnomah County, and your site has a HPSA, it has to be seeing the same amount of Medicaid and Medicare patients that exist in Multnomah County. Now let's say you are a dental clinic and your site is located in a dental HPSA. And of course, as dentists, you're not going to be taking, or likely not going to be taking Medicare, but you are going to be taking Medicaid. You just have to meet that Medicaid percentage that lives in Multnomah County. You also have to have a site application on file with the Office of Rural Health that is no more than 1 year old. And we're going to be going over, again, that site application in much more detail here in just a bit. For loan repayment, providers, eligible for providers working at eligible sites can apply to receive an award of up to 50% of their qualifying educational debt, up to $35,000 per obligation year for a minimum of a 3-year service commitment, meaning that a provider, the maximum a provider can get out of this program for a 3-year commitment is $105,000. And that is calculated based on their qualifying educational debt. So if you have a provider at your site and they are looking at their monthly statement, and their monthly statement for their loans says they have $300,000 worth of debt, that doesn't mean automatically to assume, well, 50% of that, $300,000 is $150,000, and of course we can't exceed the $105,000. So if awarded, I'll be receiving $105,000 slam dunk. That's not really the case. Your providers are going to apply to these programs. They're going to supply detailed documentation on their educational loans. We have some folks that will go through that, and there is what's known as qualifying educational debt, any undergraduate stuff, except in the case of an expanded practice dental hygienist. All of that undergraduate degree stuff is going to be disqualified. Any debt that can't be clearly tied to a provider's education will be disqualified. So inevitably, some of your provider's debt is not going to qualify for the program. Part-time providers, it's also a 3-year service commitment for up to 25% of their qualifying educational debt, up to $25,000 per year, meaning that $75,000 is what part-time providers are eligible for. This program, of course, these funds are tax-free. This particular program that we're talking about right now, providers apply to the program on a cyclical basis. We review applications as they arrive, but we review them for award and make determinations on a quarterly basis. The current quarter that we're in closes May 2nd, and applications that are deemed complete by the close of business on May 2nd will be reviewed for the cycle that we're currently in. Awards will be made around mid-May, and folks will be notified in late May. This program is a competitive program. So your providers who, again, are working at eligible sites, they're eligible providers. The activities that they're performing at the site are eligible, which we'll go into here in just a little bit. If they apply, all of those applications are scored against each other, and it is a competitive process. We will have more applicants than we will have awards in any given cycle. Providers can apply more than once. They can come back to this and reapply in a future cycle. A question that we get a lot for this program is, hey, my provider was not awarded in this particular cycle. What can my site or provider do to make us more competitive in the next cycle when my provider applies? And the answer to that is pretty much nothing. You can update your site application if you'd like, but if it's been recently filed, that's likely not going to change things much. Really, it's what the provider applicant pool looked like during that cycle. Each cycle is very different. The number of applications that we receive, the location, the types of providers, the services that are being provided changes pretty drastically from one cycle to the next. So you could have a provider who was not awarded in one cycle because they weren't deemed competitive in that pool, who now in the very next pool is extremely competitive. But again, awards are in no way guaranteed at all, and we will have more applications than we will awardees. The next program is the Oregon Partnership State Loan Repayment Program, also known as Slurp. And again, I'm going to pause for just a second. For those of you who may have joined us a little late, your conference lines are muted, but if you have a question for me, please feel free to type it into the chat box. At the end of this presentation, I am going to give instructions on how to unmute a line if you'd like to ask a question. But the best way to do it is going to be through the chat box. And I see now we're up over 35 participants, so unmuting lines may just prove to be a little unwieldy. So we may just stick with the chat box option if that doesn't work out. So again, if you have any questions at all, please type them into the chat box. Back to Slurp. Slurp is funded by HRSA. It's funded by the feds and administered by my office, the Office of Rural Health. Here's a list of eligible providers. You'll notice this list is ish like the last program that we just talked about, but I would like to point out a couple of differences. This program does not allow for NDs, but it does allow for certified alcohol drug counselor 3s. They have to have a master's degree. It also allows for registered nurses. So those are two big differences between the programs. Also, Slurp does not allow for folks who are working towards their licensure to apply. Everyone who applies to Slurp must meet all qualifications and be licensed. The qualifications for Slurp are also a little bit different. A site has to have a HPSA, much like the other program. It has to be a non-profit, which is not something the other program requires, but it is something that Slurp requires. and you have to be offering services on a free or reduced fee schedule for individuals at or below 200% of the federal poverty level. Another piece of this, of Slurp, is it requires that as a practice site, you chip in for 50% of your provider's award plus a 10% administrative fee. Slurp amounts are much like the last program with a couple of differences. It is 50% of that qualifying educational debt. It is for a 2-year service commitment for full-time providers with a maximum of $35,000 per obligation year for an initial 2-year obligation. Part-time providers, it's 50% with a maximum of $17,500 per obligation year for an initial 4-year service obligation. Again, this program does require that your practice site match a provider's award plus a 10% administrative fee. A big difference about this program, though, is the program opens September 1st, and it continues to make awards until all funds are exhausted. It is a first-come, first-served program, meaning if your provider qualifies, is eligible, qualifies, you as a site are eligible and qualified, and your provider submits an application. This application requires a little bit of teamwork between the site and provider because there is that expected match component. But as long as all of those things come together and your provider applies and the program has funds available, that provider will be awarded. And let's say my office determines, we'll just throw out a nice easy number, that your provider who is full-time qualifies for a $50,000 award for a 2-year service obligation, but $25,000 plus a 10% admin fee on that $50,000 is just not doable for you as a site. You and your provider can come to an agreement on what they are willing to accept based on the level that you're able to participate at. So if it seems like it's a little too rich for your site's blood, you can work with your provider to lower that amount. Again, all things the provider has to qualify, the activities have to qualify, the site has to qualify, much like the other program. But this program is a first come, first serve. If you qualify and the site is willing and able to match, that provider will be awarded. I can tell you that right now, again, the cycle opens the beginning of September and continues until all funds have been exhausted. Right now, the program has funds. If you're interested in participating in this program, I always urge practice sites and providers interested to start those conversations now. Contact us if you have any questions, but get that application moving, because it may turn out that, yes, we're sitting on funds right now, but over the next couple of weeks, could we get a rush of applications? Very possibly, and we would burn through the program funds and keep moving. It's first come, first serve, so we'd work through the stack and encumber program funds until they were all exhausted. We will run out of money at some point for this program, and then we'll stop making awards again until next September. So if you are interested, please don't delay. Do look at this program and do encourage your providers to apply sooner than later. Slurp also allows for continuations. After initial 2-year service obligation for a full-time provider or 4-year service obligation for a part-time provider, folks can come back to the Slurp well for up to 2 1-year continuations, and the award amount for continuations goes up a little bit. Again, that can still be, your site does have to match plus participate with the administrative 10% administrative fee on top of the whole award, but your providers can come back for up to 2 1-year continuations. The maximum a provider can receive through Slurp, period, is $100,000. So a provider full-time provider who maxes out at the possible award amount of $70,000. Let's say your site can participate at that, the provider is awarded at that. The provider could come back to the Slurp well up until they've either reached their maximum participation amount of a 2-year service obligation and 2 one-year continuations, or until they reach $100,000, whichever comes first. Providers must also qualify for an award of $5,000 per obligation year to be awarded. So if you had a full-time provider and they qualified for a $9,000 award for spread out over those 2 years, unfortunately, we'd be unable to award that person. Again, it does have to be $5,000 per obligation year for an award to move forward, but that fairly rarely happens. Hours and requirements. This is true of both programs. Full-time means working at least 40 hours per week with a minimum of 32 hours per week spent providing direct patient care for a minimum of 45 weeks out of a service year. Part-time means working at least 20 hours per week with a minimum of 16 hours per week spent providing direct patient care for a minimum of 45 weeks per service year. This is very important because the definition of the program's definition of full-time or part-time may not be the same as your practice site's definition of full-time or part-time. So if you have a provider who is scheduled for 36 hours per week, but 36 of those hours are, 32 of those 36 are spent providing direct patient care, that provider is not meeting the 40 hours per week minimum required for full-time, and they would be considered part-time. Those providers can apply for part-time awards, but again, the amount that they'd be looking at would be lower. So again, you do have to be meeting that 40 hours per week to be considered full-time, and 32 hours of that does have to be direct patient care. And for part-time, 20 hours per week, 16 hours direct patient care. The 45 weeks out of a 52-week period, all providers' CME days, holidays, training days, sick days, all of those days get rolled into that allowable 7 weeks off. Providers, so if you have a generous time off package that goes above that 7 weeks, your provider, if awarded through this program, would be required to work a minimum of 45 weeks out of a 52-week period. Some very important pieces of this definition is patient charting, and is considered a component of offering direct patient care, but many other activities are not. Time spent in management roles, teaching roles, as a medical director, those are all administrative duties, and that cannot count towards your 32 hours or 16 hours in the case of part-time for direct patient care. So if you've got a provider who's in a leadership role, perhaps they're doing policy work, perhaps they're doing advocacy work or other activities, and they're not meeting that 32 hours of direct patient care, they may be eligible for a part-time award as long as they're providing 16 hours of direct patient care. However, if in the case of a provider who's in a leadership role or doing other activities that are not at least meeting that 16 hours per week of direct patient care, they will not be eligible for an award. Clinicians who are employed in an inpatient setting in a full-time capacity are not eligible for an award. So if you have a clinician who's part-time inpatient, part-time outpatient, they may qualify for a part-time award, but any time spent in an inpatient capacity is not going to be counted towards your completing those required service hours. So any inpatient work is not allowed. Other service obligations. If you have a provider at your site who is currently participating in, say, National Health Service Corps, Nurse Corps, any other state or federally funded programs, or really any other program that offers funds in exchange for a service obligation, that provider is then eligible to participate in any other programs until, at least administered by our office and on the federal level, until they complete that service obligation. Some of them are very obvious, again, like National Health Service Corps. Some are less obvious. Employer funds and bonuses that must be paid back in full if a provider leaves a site before a set date is considered a competing service obligation. So at your site, if you offer a provider, we'll just throw out a nice easy number and say $20,000 signing bonus. But if that provider leaves the site, and again, I'm just throwing out a number, within 2 years, that provider must pay back all of that signing bonus. That is considered a competing service obligation. If that signing bonus has a required payback language that is prorated, so by every, say, month or every quarter that the provider works, that provider needs to pay back less and less, that reads more like a forgivable loan than a competing service obligation. So do know that if you have language in your contracts, employment contracts, that says, here is a pot of money, and if you leave our site before X date, you must repay in full, that is considered a competing service obligation. I have a question that just popped up. So I am going to read this out loud. Does that include the Federal Public Service Loan Forgiveness Program? I'm very glad you brought that up. No, that does not include the Federal Public Service Loan Forgiveness Program. And for those of you who don't know, that is a 10-year program that is just now having providers exit out of that program with some mixed results. I'm not going to go too far into that. Please read up on that program, but do know that as far as my office is concerned and programs administered through the Office of Rural Health, we do not consider that to be a competing service obligation, and one of those reasons being a provider could walk away from that program with absolutely no penalty. Tax credits and insurance subsidies, the same thing. At this time, we do not consider that to be a competing service obligation. It is you complete the, for tax credits, you have to work in a community, and then you submit an application with my office for the tax credit, and then as long as you're eligible and meet criteria, you receive it. So it's not something that if you walked away from it, you'd be penalized, you wouldn't get the credit. But it doesn't require payback of said credit. Thank you very much for that question. Again, if anyone else has questions, please feel free to type them into the chat box. So this is a lovely picture of our beautiful website. If you type into Google Oregon Office of Rural Health, we are usually the first thing that pops up. And if you see this sweet whitewashed barn, you know that you're on the right website. Providers, and really if you're interested in seeing that list of eligible providers, if you're interested in finding the provider application, that can be found on our website by clicking the Provider Incentives tab. That will generate a drop-down menu. Once at this menu, click on the Loan Repayment option. It will take you to this Loan Repayment website, and the program that we just got done talking about, Slurp, is located here. Loan Repayment, Oregon Healthcare Provider Incentive Loan Repayment, is located here. Click on those links. It'll take you to a lot of the information that we've covered today, including eligible providers, eligible sites. With Slurp, it'll cover the match component, and providers can also find applications here. But what we're really here to talk about mainly today is the site application, the link for which can be found on all those sites that I just mentioned, but it's most prominently located right here where you can see that arrow at the top of this loan repayment website here. So if you click on that link, it's going to take you to a PDF, a fillable PDF version of our site application. The site application is how my office collects data and information on your site, and it allows my office to review your site for all incentive programs administered by my office, with the exception, of course, of tax credit insurance subsidy. That is a different application, but talking about loan repayment and some loan forgiveness programs that are for students. Again, I could do a whole nother webinar on loan forgiveness students, but those folks are given money for their medical education while they're still in school, and once they graduate, they have an obligation to work at a practice site approved for their program. So if you are interested in loan repayment programs, which is great, there's also loan forgiveness students out there who are going to be coming up on graduation. We've got a new batch of folks who are going to be graduating this year with obligations. This application is going to allow my office to review your site for all of these programs. Just another question come in, so I'm going to take a second to read this. Does a representative at our site complete this application, and how often? So yes, we'll be going into that a little bit more detail, but I would like to answer that question to make sure that we do touch on that. So yes, a representative at your site, and it's going to, we have language that I'm going to go into a little bit more detail here in a couple of slides, but yes. So an authorized legal representative from your site. We cannot accept site applications that are sent in by providers, even if you as a site administrator completed it and said, hey, send this off to the Office of Rural Health. I know you've been working with them. Here goes the application. Please submit our site application. We do have to get it from a site administrator, and that could be someone on that site administrator's admin team. So you could have, say, a clinic manager, an executive director, someone on that administrative side of things, an HR representative or director, fill it out. Perhaps they submit it themselves. Perhaps they have their admin person submit it. Those are also acceptable routes. But it can't be filled out and or submitted by a provider. Site applications are valid for 1 year. If you contact my office, we'd be happy to let you know how old your site application is and how close you are to needing it updated. But again, they are valid for 1 year. So if you don't know, or if you don't know if you have a site application on file, I'm going to give you some contact information here towards the end. Feel free to reach out to us. If you have multiple sites, again, we'll be going into this a little bit more detail, but each individual practice site, each individual address is going to need its own its own application. So we'll go into that in a little bit more detail, but do know that if you work for XYZ Healthcare and you have multiple sites throughout Oregon, we can't complete just one site application. It has to be on each individual location. I just got another message that says thank you. No, thank you. I appreciate you. So also the site application helps us keep in contact with your site about changes to incentive programs. A lot of you likely heard about this webinar because you or someone at your organization had filled out a site application and we had some sort of contact information for you or your organization on file. We never spam you. We never want you to participate in our kids' cookie drives or anything like that. This is all information on incentive programs, and if there was a change to Slurp or a change to the Healthcare Provider Incentive Loan Repayment Program, which the legislature has the ability to do, we would keep you informed that way. We'd keep you informed of these webinars. So you'd only be getting a couple of targeted emails from us if you do fill out this site application. So some components of this site application, I'm going to zoom in on this first part here. The first bit is pretty straightforward. The name of your practice site, the street address. Again, for this particular part right here, we are looking for the clinic level stuff. If you have a parent organization, it's going to be down here. So if you were XYZ Health Services and you had sites 1, 2, and 3 throughout Oregon, we're going to need the actual practice site address to be filled out in box 1, and box 2 is where you'd input that parent organization information. The practice site contact here is very important. This should be someone at your organization who can activate, can field questions. Sometimes we have folks list the executive director as the practice site contact, which is okay. That's fine, especially if you have an executive director or a practice site manager who's really involved in day-to-day things. But really that practice site contact is someone that, let's say, I receive your site application and I've got some questions about your site application. I'm immediately going to go to that practice site contact and reach out to them. If it is someone who is extremely busy and can't quite triage calls, it may delay your site application. Also, once we have a provider at your site, your provider applies. Let's say that provider is awarded. If there is ever something that pops up and we need to ask your site a question, this is we're going to go to your practice site contact at first. We do ask for one practice site contact to be the main point of contact. In our database that we maintain here, we can put other folks in there, which is fine. We can work that out with you and your site. But this practice site contact, again, should be the main point of contact for your site. Box 2 is where you'd put in your parent organization information, and 3, you would indicate which HPSAs your site has. Just below this that got cut off in the zoom in is a link to a HPSA finder. I can tell you I use the HPSA finder every day, and I know how to navigate it pretty well at this point. It took me a little bit to get to that point. The site can sometimes make it seem like perhaps you don't have a HPSA, or perhaps your HPSA, or possibly do. There's different views that you can look at. Sometimes HPSAs can hide. So do know that do your best. I encourage everyone to take a look at that tool. But do know that when I get a site application here, I'm usually the first person that looks at it. And after reviewing some basic information, I go into the HPSA Finder tool and I dig for HPSAs and find some that perhaps you don't know exist, or perhaps, again, like I said, geographic non-facility HPSAs were recently updated, and I found that a fair amount of folks seem to have not known about that because they were listing old HPSAs and hadn't been in that HPSA Finder tool for a little bit. So if you were familiar with the tool but haven't been into it for, since the past 6-8 months, I encourage you to go digging around in there. But again, don't feel too bad if you can't quite figure out the tool. If you end up leaving it blank, I'll do the same amount of research that if you put in all 18s. So do your level best to find this HPSA information, but do know that I'll go also verifying this information and looking also. So this moves on to page 2. We're going to zoom in on these couple of questions here. We ask if your practice site is located in an area of Oregon that is designated as rural, and again, that is an official designation. There is a website that we have where you can look up your zip code. Rural designations are zip code dependent. And do know that if your site is not located in a rural area, no worries. That will disqualify you from one loan forgiveness program. We have a program called the PCLF, Primary Care Loan Forgiveness Program. Again, that's money given to students, and those students graduate from school with a service obligation, and they are required to practice in a rural primary care setting. Practice site has to meet some other requirements, but so if you mark no, I have had some sites report, well, gosh, I wasn't rural, so I didn't move on with the application. That it won't disqualify you. We have plenty of awardees and loan repayment programs, and one of our loan forgiveness programs that it does not require that your practice site be rural. Question 5 asks if your site is for-profit or non-profit. Again, marking for-profit is not going to disqualify your site from all programs. There is one program, that Slurp program that we spoke about, does require your practice site to be a nonprofit. But if you're not rural and you're for-profit, you can still access a number of our programs. We ask if your clinic is private or public, and please do, for-profit or nonprofit, private or public, please do mark this information, because if those boxes are left unmarked, I will reach out to that practice site contact, but your site application, if it's not complete, does go into a bit of a holding queue until I can get that information. So do please complete that information. Then we ask you to select one here. Here in our next update, we're going to be adding some more clinics, facility types to this list, but do your best to mark which kind of clinic you are. Those links that you can tell, some of those things are hyperlinked in the PDF version. Things like a critical access hospital, a certified rural health clinic, those are all official designations, and I have links here that will take you to a place where you can find out if your site is is one of these designations. If not, simply mark other and then include what that site is. Currently, before primary care practice was considered to encompass dental facilities, but we found that enough people are marking other and dental, which is fine. In fact, I encourage you to do that, but in a future version of this, it will include like dental facilities called out. For the time being, if you're a dental facility, please feel free to mark either primary care or dental, other, and then dental. Again, I'll be doing research on your site in the background anyways. This is just good information for me to start that research. And then whether or not you're a patient-centered primary care home, if you don't know what that is, you probably are not one of them. But I also do research on that as well. So please, if you're not quite sure and you mark no, do know that I do the research, even if you mark no, to check on that. But if you don't know what it is, I highly encourage you to check it out. Do some digging on whether or not your site is. You might just learn something from this. Just had a question pop up. It said, are these slides available for our review later? Thank you for that question. Yes, it is going to be my intention to convert these to a PDF. Also, this meeting is being recorded, so it is also my intention in the future to send out these slides and send out the recording of this to our listservs, which should include you. Now, again, if you didn't directly receive an email from us, it may turn out that you heard about this from a little bit of a roundabout source. Please feel free to reach out to me if that's the case, and I'd be happy to include you on an email. But this will be going out to our listserv here in the future. Sometimes it can take, it probably won't be until next week until this information is ready, but it will be sent out to folks. So we're going to move on to the next bit. We zoom in on part 6 here. Part 6 is actually trips up a fair amount of folks. The first part is pretty straightforward. Are the majority of your providers eligible for reimbursement for Medicare, Medicaid, or both? Again, in the case of a dental clinic, you're probably going to be accepting Medicare over Medicaid. That doesn't trip a lot of folks up, but what does are the next bits here. Pardon me. So, the date range for the patient demographics listed below. So, we have to have an actual date range. We would accept, January to March 2019. Of course, we'd have to wait for March to completely close out, but it would have to say January through March 2019, or 1/1/2019 through 4/1/2019. We get a fair amount of applications that come back that say 1 year or 3 months, physically, written out, literally 1 year written out, or literally 3 months spelled out. We can't accept that. It has to be an actual date range, and it does have to be at least 3 months worth of data. Another thing that we get a fair amount is data that is considered out of date. These site applications are valid for 1 year, and some of this data is used not only to qualify your sites, but also looking at providers in an applicant pool. So if you submit a site application that has data from 2017, that data is more than 1 year old and is not valid. Even data that is approaching like 6 months old, that is going to degrade the life of your site application. Because what I'll say is, okay, we will accept data that is, 6 months old, but I will come back to you and say, hey, this basically cuts the life of your site application in half. So do know that if you for the longevity, so you don't have to keep coming back to this, please do submit your most recent data. We ask for the number of unduplicated patients seen at the site for the date range above. Now that means that, let's just throw out a nice easy number and say you had 50 patients seen at that address over the course of those 3 months, you had 50 total patient visits. So in your record, you have 50 patient visits. Now, those 50 patient visits are made up of 40 unique individual patients. So you had some patients who came in for a one-off visit, and then during that 3 months didn't return. But you had a couple of patients that returned for whatever reason, and now those 40 unique patients made up a total of 50 patient visits. We are looking for that 40 number. We are looking for how many people, not patient visits, but how many physical individual folks were seen at your site for that date range. And the percentage of sliding fee schedule patients. For some of you, that's going to be NA. For some folks, that is, we don't offer a sliding fee scale. Again, that's not going to disqualify your site from all programs. It would disqualify your site from the state loan repayment program, also called Slurp, that we spoke about. But it's okay if you list NA in there. And your percentage of Medicaid and Medicare patients, again, for that unique set of patients, not the percentage of patient visits, but for those unique patients. And then, if available, the percentage of your patients that fall below 200% of the federal poverty level. If your site isn't collecting that, that's okay. You can put NA in there. That piece is good data to have, but isn't necessary for your site to be qualified. And we're going to expand on the last bit here, which encompasses 2 pages. So this is a view of those 2 pages squished together. This requires that an executive director or legal representative at your practice site initial next to each assurance, which if it is the affirmative, your executive director or legal representative would initial to the affirmative next to the applicable attestation. It's not necessary that your site is able to answer to the affirmative to all of these attestations to qualify for all of our programs. But I can tell you, if I get a site application back and none of these are initialed, I will ask that you re-look at them, because some of them are simply, we assure that salaries for health professionals participating in loan repayment programs are based on prevailing rates, and loan repayment programs are not used to offset that salary. If you're not initialing to the affirmative that, I'll ask you why, and sometimes I hear back because I didn't know about it, but now you do, so please initial. It's not necessary that your site is able to attest to all these things, but again, please do initial the ones that are relevant to your site. There are 2 of them currently on the site application that if your legal representative or executive director initials next to, it requires some backup, and that is if you are able to say that you do not discriminate on the provision of someone's ability to pay, we do ask and require that you submit your site or your policy that backs that up. And if you're accepting or offer discounts for folks at or below 200% of the federal poverty level, we require that you submit not only your policy to that, but also the application that patients fill out to qualify for that sliding fee scale. So we've covered the assurance bit, so I'm going to gray that out, and we're finishing out with, which it's not going to expand, but that's fine. Really, this is your executive director or legal representative must finally print their name, print their title, sign it, date it, and then put their contact information. It is important that it is signed and dated. Applications that are not both signed and dated will be returned. And finally, right below that, there is the information on how to submit the site application. The very best way to submit a site application is going to be to fill it out. We do accept electronic signatures. It is a fillable PDF, so if you fill out this site application as a fillable PDF, you can include a digital signature, and then save it as a final copy, email it to us. You can scan it, print it, fill it out, scan it, send it to us. There is a fax option, but the problem with the fax option is sometimes faxes aren't as reliable. If you do fax it in, I encourage you to please check with us to ensure that your fax went through. For whatever reason, we do inevitably get about, once, twice a month where a fax simply doesn't come through, and we don't see that site application. If you emailed it in, you've got a nice record that you sent it in, and you'll get a response back that it has been received. So it's just a nice record for everyone to have. It makes things a lot cleaner, whereas the fax method is a little bit more nebulous when it comes to that. So that covers two of our loan repayment programs. That covers the site application. The Office of Rural Health does much more than that. Incentive programs are great, but they're not the beginning nor the end. We can help you with so many other things. We can help you post jobs on this job board that we run. We can help with, Stacy Reed can head out to your facility to help you identify strengths and weaknesses. We can help connect you with those loan forgiveness providers. It's actually a really interesting time of year because coming up starting in June, we're going to have a whole batch of new awardees who are going to be graduating. We've got, NPs, we have PAs, we have mental health providers. We have all these providers who are going to be graduating from school who have a service obligation built in. So if you're interested in accessing some of those folks, I highly encourage you to fill out a site application. We do ask, part of the site application I didn't show you here is if you're currently recruiting, and if you do fill that out and you're recruiting for one of these areas and that some of our providers are interested in going to, and we have providers interested in all areas of the state. We have providers who can go urban, rural. We have folks who are interested in Eastern Oregon, the coast, really all over. So I do encourage you that, loan repayment programs we spoke about are great, but there's so much more out there that we can help you with. Feel free to give us a call. We'd be happy to talk through what we can help you with. So with that said, we have come to the end of the presentation. I'd really like to thank everyone for taking the time out of their schedules to meet today and hear me talk for the last hour on incentive programs. There's information here about how you can reach us. Please feel free to email any one of us. We'd be happy to route your email to the appropriate person. If you're not sure who it should go to, connect with us on social media. And, old school, feel free to give us a call. So if you have any questions, we do have about 8 minutes left in our time. If you have questions, feel free to type them into the chat box. I am going to hold off on unmuting lines because we still have about 40 people. And if I unmute lines, it'll be a little bit of opening the floodgates. But if you are interested in unmuting your line individually, I have mixed results with this, but you can press *6 to unmute your line. So if you are interested in unmuting your line and asking a question, please feel free at this time to press *6 and ask your question, or type your question into the chat box. I'm going to take the silence that we're experiencing right now as a sign. Ooh, there we go. Darn it. I was just about to go into how great I was, but now we have someone who's going to break that up. Please, do you have a question?
Yes, I do have a question. On these site application, when you are asking for a date range and it says minimum of 3 months, I understand about putting actual dates in, but is there an advantage to offering more data than just 3 months?
Possibly, yes. That's a very good question. I really appreciate you asking that. Yeah. So, the minimum is 3 months, so you have to have a minimum of 3 months of data. But, let's say you're at a site and your patient demographics are a little bit seasonal. Perhaps you have a migrant farm worker population, and or perhaps you're in a more touristy kind of location where, okay, well, if you look back at the last 3 months, when the tourist season is over, or perhaps it's, we have less populace at that time, the last 3 months isn't a good representation of the data that your clinic is seeing. So if you came to me and said, hey, Bill, here's data that represents from, January 1st, 2018 until, March 21st, 2019, that's very acceptable data. And perhaps for your clinic, that is a better representation of what's going on. Perhaps it's not, and perhaps the last 3 months. Some people find that trying to pull that much data, especially if you're a larger facility, can be a bit cumbersome to filter through a lot of that stuff. And they just say, you know what, I'm going to provide you with the last 3 months because it's easier for me and my demographics really don't change. So there you be.
All right, thank you.
Oh, thank you. So we do have at least one person typing a question, so I'm going to hold. Again, if you do have a question right now, we were successful, luckily, at pressing *6 to chime in. I'm so glad the question came up because I was just about to go into my rendition of songs from the HMS Pinafore. Would the Oregon Department of Corrections qualify as a site? Very possibly. Very possibly. There is language that allows definitely in some of our loan forgiveness programs. There is, I believe, one Department of Corrections site that qualifies at least. I think it's perhaps Snake River Correctional Facility that qualifies, and you kind of go, wait a minute. That seems like almost kind of the definition of inpatient work. Doesn't that disqualify? That inpatient work is a real, 99.9% of the time, inpatient work is not going to qualify. However, this particular scenario does qualify. There are also some state hospitals that do qualify for programs, and they do have some inpatient going on and some severe psychiatric cases. Some of those folks are inpatient. A lot of that has to do, in those cases, with providers being outpatient providers who then their mental health patients end up in an inpatient setting, and they end up kind of seeing those patients. So for continuity of care, in those very limited cases, yes, that can sometimes work. But 99.9% of the time, inpatient work simply is not allowed. But in a case like the Department of Corrections or state mental hospitals, that is a possibility. Also, we understand that the Department of Corrections folks aren't exactly accessing Medicaid, Medicare. So if you do have a Department of Corrections site, and you say, gosh, I really can't say percentage of Medicaid, Medicare, we do understand if you can include a note with your site application that says, hey, the reason why this data is left blank is because our site is Department of Corrections and that the patients are, patient care is rolled into our budget and it's free for these patients, or if the patients do have to contribute somehow, we'd also like to know that information. But yes, in those very unique cases, that kind of inpatient, not quite seeing Medicaid, Medicare, but it's a different kind of system will work. But again, that is definitely the small exception to the broad rule. And we've got just about 2 minutes left. If there's any other questions, I'm going to talk very slowly. We're going to give it just a little bit. And my singing voice isn't quite there. I have to maybe take a drink, give it a second, do a little dance. Okay, I'm going to go ahead and make the executive decision to go ahead and end our webinar a full minute early. So please use that full minute of your time wisely, and hopefully there's sun in your area. Here in Portland there is not. I am going to stay on the line for just a little bit because I do see, oh, very helpful. No, thank you. I really appreciate your question. You had a very great question about the Department of Corrections, so I appreciate you bringing that up. But again, we're going to go ahead and end this portion of the webinar. And if you have any questions at all, feel free to contact us. There's always someone here during business hours who is more than willing to help. If, if you'd like a presentation done at your site, we'd be happy to set that up as well, especially during, as we approach the spring, summer, and fall months. It is easier for us to do a little bit of travel. Stacy Reed, our recruitment retention manager, is actually based in Madras. We also have some folks who do some regular tours. So if you would like us to come out and talk to your site, we're more than happy to do a one-on-one webinar as well. We do these webinars about twice a year for general folks, but again, we're more than happy to set up one-on-one or group webinars or in-person meetings. And with that, I'd really like to thank everyone for taking the time, and it's almost Friday, so please enjoy. Take care.